You know, the thing about a lot of these institutions where there are multiple locations is we find that there's quite a bit of fragmentation of data between the different sites, where data is housed at the different sites, creating kind of silos between these facilities as well. So it does make things quite challenging from managing employee records, tracking time, also comes to payroll calculations as well, because a lot of the things are done manually. And it does bring a lot of risk to your organization, because one of the questions we always ask when implementing, companies, healthcare institutions with multiple sites is, what is the single source of the truth? Because the information we want to migrate into a particular new system, it has to be 100% correct. There is no room for, 60, 70% accuracy. It has to be 100% correct. The other issue that comes in is the complex nature of the compliance requirements in the healthcare sector. Healthcare sectors need to, when we're talking about labor law requirements, we're talking about tax requirements. There are different shift patterns. There is quite a few complex rules that are defined by that particular sector as well, in South Africa especially, that needs to be complied with. And managing that across multiple sites is extremely challenging and can result in certain errors that come into play, which increases the risk for your organization. One other thing is, with regard to what we find, is having a whole lot of manual processes as well as legacy systems, creating these silos. And in doing so as well, a lot of employees find it that they don't have the necessary access to really pertinent information for them. And when employees feel disengaged from an organization, inevitably they look elsewhere. So what happens from an HR perspective? You tend to find that there is staff shortages, there is a high staff turnover, which puts a lot of pressure on the HR teams to manage recruitment, onboarding, and payroll efficiencies across multiple locations.